Hello and welcome. This is Dr. Suzanne. Today I would like to talk about a sensitive subject, which is a micropenis. Why did I decide to talk about it? I had a patient actually. The mother came with this boy because her main complaint was that the child has a very small penis and she wanted to know what to do about it. So I looked at the child and yes, I can confirm, stretch, it was maybe this size, maybe an inch and a half maximum, and very small. So then I asked the mother, is there anyone around you who may have this condition, like your brothers or, I didn't want to get into details, but right away she said, his father. And I was like, oh, his father. So how, is he going? What's his size? So she showed me he's like this. And she made sure to tell me that she wasn't with him anymore. So I decided to talk a little bit about this. And I'm going to show you the different possibilities of p-scepters, okay? But what I would like to say is that a micropenis is a penis that is 3 inches or less, okay, in size when stretched and ready for action. And I'm going to show you some examples, of course, with some vegetables, okay? I cannot... Look, I'm using vegetables. If you don't like it, move on. Anyways, so let's take a look, okay? 1 second. All right, as promised, I'm showing you different p-scepters or penises, okay? Here at the far end, you have one of the largest, okay? This average normal size usually. This very realistic. The difference between this and this is in the circumference, okay? And then this is very, very, very common. This is barely out of the micropenis definition. And this one is what we would call a micropenis. So just compare this size to even this size, or this size to this size, or this size to this size. Kai. This is the definition of the micropenis, okay? It's going to be 3 inches. 3 inches now. You see here, my mark of 3 is right there. So this is very realistic of a micropenis. So if I take it now, and I just slide it, maybe let's say even here. Can you see now? Disclaimer. In the Christendom, we recommend not having sexual intercourse before marriage. But I'm showing you the different possibility you will have the night of your wedding, okay? All right, now that we've seen the different sizes and shapes of p-scepters, let's look into what is a micropenis and what could be the causes and what is the treatment offers or different options of treatment. First of all, we talked about the size. The size is going to be 3 inches of less or less, like this little okra is 3 inches, if you can see, okay? So this would be a micropenis. My patient, because he was 10 years old, his was probably, 1/3 of this size. Seriously, 1/3. So this was this little boy. And talking with the mother, I understood that there was something genetic going on because the father had the same condition. So what happens when you have a micropenis? First of all, the causes can be multiple. Number one, genetic causes. In pediatrics, we deal with a lot of genetic conditions, but a couple of them can cause a micropenis. One of them is Klinefelter syndrome. The other one is Prader-Willi syndrome. In the first one, the kids are super tall, super skinny, and in the second one, the kids are really obese, okay? But those are genetic conditions that have a micropenis as an identifier. You can have an issue with the hormonal pattern, like we need testosterone. A baby boy needs testosterone to differentiate as a boy, as an XY. So if there is a blockage of testosterone in any pathway, you know, from the main hormones in the head, like the pituitary gland, the hypothalamus, the testes, if there is any genetic deficiency, testosterone is not going to get where it has to go, and yes, the child is going to have a micropenis. You can also have abnormal genitalia during pregnancy. Maybe the mother is taking something she's not supposed to take, and that's going to block the development of the child. The diagnosis of a small penis is physical exam. You see it. The first person to diagnose that is the mother. Okay, she will see it, she will worry, she'll be like, what's going on here? And then she comes to the pediatrician. The pediatrician is the first line provider who confirms the diagnosis. And then what we usually do, what I did with my patient, I refer to the urologist, because the urologist can start a therapy with testosterone. First of all, you want to get blood, measure hormones level, especially testosterone. If the child doesn't have enough, he can actually get supplements, and those supplements would help the penis, you know, expand and grow better. But every case is really different, as you know. Now, for adults or teenagers, you can also have the possibility of surgery. They can get a penile implant. That's the urologist who is going to deal with that, of course. Now, there are two things that I recommend. The first one is a topical treatment. Topical means just applying a cream on the skin and massaging. I have a p-scepter oil that is infused with good spices and herbs that are known to increase testosterone. So when the patient uses that, well, at least twice a day, apply a few drops on the glands, on the shaft, and massage really well, massage, and then use a penile pump. With time, there's going to be some results, okay? So that's one way. The second way is to do a P-shot. So for example, when patients do the P-shot, let's say you were this size, and I do a P-shot on you, you will become kind of this size, okay? Or you were this size, or maybe this size, and when I do the P-shot on you, you become, you know, this size, okay? You gain usually 2 inches, 2 to 3 inches, okay? So that's what the P-shot will do to you. What is a P-shot? The P-shot is a technique developed by a medical doctor where we take your serum, we process it in a very specific manner, and we re-inject it inside of you. So it's basically giving you a new life, a new breath, and then your body is going to pick up and begin to reorganize itself and grow naturally, okay? After the P-shot, we always recommend, I at least always recommend using massages and oils that will continue to enhance the growth and maintain your growth. But basically, you don't need to have a large p-scepter to satisfy a woman. That's the takeaway from this talk. Because even with a very small p-scepter, the father of that child was able to have children. He was able to give pleasure to his wife. He was able to accomplish a lot of things. Why? Because you only need 2 inches to get to the G-spot of a woman. And when you get to the G-spot of a woman, you can give her great orgasms. Now, you can also just stay outside on the clitoris and the vulva and also give her orgasms there. But a micropenis will never prevent giving joy to your wife, okay, or to a woman. Now, as far as fertility, as long as your sperm is of good quality and healthy, you just shoot it in the vagina, and the spermatozoid, they're just going to find their way, okay? Find their way to the uterus, to the ovaries, to the egg, and cause, pregnancy to occur. So really, having a micropenis is not necessarily a problem. I know a lot of women prefer to have men who feel them well. So, ladies, if you have a husband that has a micropenis, don't go use the toys. Don't go get a toy like this. Anyway, this was Dr. Suzanne. And if you have any questions about the P-shot, please give me a call. I'm going to leave a link under here where you can reach out to me, or you can just simply ask your questions here. You can email me, you can DM me, go find my Instagram, Libido Doc, and DM me. It's private, nobody's going to see, and I'll make sure to answer, okay? Have a wonderful day. Bye.